World leaders have agreed to a political declaration on universal health coverage at the UN General Assembly, a move that will see governments roll out health insurance across populations. According to the World Health Organization, more than half of the world's population is not covered by essential health services. NTV's Bridget Ngana reports from New York.
The 70th United Nations General Assembly has seen a win in the high-level meeting on universal health coverage, with world leaders agreeing and committing to supporting this type of healthcare politically and financially.
The political declaration you have approved today is a strong signal that you are making that choice. But the choice is not just made on paper. It's made by investing in primary health care, which is the most inclusive, equitable, cost-effective and efficient path to universal health coverage.
According to the World Health Organization, 4.5 billion people across the world cannot afford basic health services, and the World Bank estimates that paying for health out of pocket is one of the causes of poverty and inequality across the world.
Almost 800 women die from preventable complications of pregnancy and childbirth. Every day, 14,000 children under 5 die, mostly from preventable and treatable causes. And every day, more than 100,000 people die prematurely from non-communicable diseases. This is not a technical problem. It is a political problem.
It is not only about investment, it is about quality health care. So we need to have the whole value chain of the health system being dealt with, that reaches from the health workers to the doctors, and to allow them to provide the health services that people deserve.
Kenya's Health Cabinet Secretary Susan Nakhumicha addressed a multi-level panel discussion on universal health coverage, and she says that this time, when Kenya will be launching its own version of the same, things will be different.
For primary health care to work, we must begin at the bottom within the communities, and we must involve the people themselves about their health. And number two, that we must focus on our health workers. Those are the takeaways that I have taken from here. But most importantly is that as ministers, we are being called to action.
Kenya will be launching universal health coverage in October, and this time it will be the 4th, and there is hope that the lessons gathered from this General Assembly will ensure that it is effective this time round. Bridget Ngana, NTV, New York.